when you apply a pelvic splint, it's important to follow local protocols. You shouldn't log all the patient, and JLCOG recommend the use of an orthopaedic scoop stretcher, just performing a 15-degree tilt. We're going to utilise that 15-degree tilt to apply the Prometheus Pelvic Splint, therefore minimising any movement of the patient. There are instructions of the splint included in the pack, so it's a good idea to have a look at that to familiarise yourself. When you take it out of the pack, you'll see there's a blue strap and a yellow belt. Put the blue strap to one side for now, and just unfold the yellow belt once. You'll see there's a black side, and the black side goes against the patient. Locate the patient's greatest counter, which on the patient here is there, and we lay the belt there midline to the greatest counter. All we have to do now is take the top part of the belt and unfold that down to an L shape down the patient's leg, making sure the midline is still in line with the greatest counter. We can now put the scoop stretcher in place. Over to you.
Ready, brace, roll.
Once the patient is in that position with that 15-degree tilt, I can now slide this yellow belt to the midline, still making sure I'm in line with the greatest counter there in the middle of the belt. Once we have that in place, I can now slide the scoop, which has been pre-measured to our patient. Okay, when you're happy.
Ready, brace, lower.
We can now move to the other side, taking our blue strap and our forward shears.
Ready, brace, roll.
Again, this one's got that 15-degree tilt. I can then reach, and I can pull this half of the belt back around the patient, still in line with that greater counter, and I can now attach the other half of the scoop. In at the head, in at the feet.
Ready, brace, lower.
So as you can see, just with one movement, we've applied the Prometheus Pelvic Splint and the scoop stretcher. We can now take the blue strap. The tip for this is to keep that elastic band around the strap, because this stops it inadvertently sticking to the belt while you apply the strap. I'm then going to take one of the triangle anchors. As you can see, it's that arrow over the greatest counter. I'm now going to place that on this side. Now I can trim this yellow belt to the patient's size. By trimming the belt, we have access to the groin area. So if I trim that yellow belt now, making sure I don't cut through the blue strap. I can now take the second anchor, keeping the strap well away from the yellow belt for now. I can then affix that to the other greatest counter. And then once again, if you hold that for me, there, I can now cut the size. Again, making sure I'm not cutting through the blue strap. Now we can pull these two square straps here, making sure the buckle stays centrally over the patient. We can now pull with equal pressure, and we can apply tension to the belt. If we apply sufficient tension, so that we can then stabilise the fracture ends and help preserve that clot. We will either see normalised anatomy come back round, or you feel that you have enough tension there to ensure you've got stabilisation of the pelvic ring. As you can see now, we have exposed the groin area, so if they need to get at the femoral area, or catheterisation they can do. The patient is now ready for packaging.